So good afternoon dear friends, my medical colleagues, my healthcare entrepreneurs and all the viewers who have been following my YouTube channel. Carrying forward towards discussing about medical achievers. Today with us we have Dr. Narkar, an esteemed ENT specialist, has been practicing in Mumbai in western suburbs of Dahisar for past 14 years. After earning his MS in ENT, that is ear, nose and throat, from the prestigious Sinus Hospital, Dr. Narkar further honed his skills with hands-on experience in various BMC hospitals. While he treats a wide range of ENT conditions, his expertise and passion lie particularly in ear surgeries aimed for restoration of hearing, as well as managing thyroid-related disorders. So welcome to our channel, Dr. Narkar.
Hi Vishal.
Thank you so much for being with us. So immediately we'll rush down to the question. As you are an ENT specialist, what in this particular festive season, like how Ganesh festival has got over and now upcoming festivals which will include Navaratri, Diwali and many other festivals, according to you as an ENT specialist, noise pollution will be one of the major factors in such festive seasons. And what would be your advice when it comes to impact of noise pollution on people who already have some challenges in ear deafness? Firstly, what is the prevention or precaution to be taken? And secondly, if there are going to happen some complications due to this noise pollution, what are the early remedies or treatment we have for the same?
Okay, so now as we have seen, the Ganesh festival or any other festival for that matter has evolved over a period of time so much that nowadays the focus is more on the musical aspect and the DJs and all those things. Now music can be a double-edged sword. When listened in a proper volume, it is a soothing and a relaxing experience. Whereas if the sound crosses a particular threshold, say around 90 or 100 decibels, then it causes a lot of problems to the ear. There can be problems with the eardrum, the auditory nerve which carries sound from the inner ear to the brain, even that can get damaged. It is the loud sound cause a lot of discomfort to children and to elderly people. Of course, we are not even talking about the aspect of noise pollution on the dumb animals which cannot speak, the cats and the dogs which lie roadside. So everyone is affected. In fact, a few days back, there was this article about Mrs. Alka Yagnik, who is a famous singer, that she got affected by hearing loss. And unfortunately, it is a irreversible condition most of the time. So the prevention aspect will be, of course, the majorly it will involve educating the people, educating all those mandals who organize these festivals, that to curb down the intensity of the noise, the music which they play. And for public, for common public like you and me, it is advisable not to step out during the times when these processions go on. The government should put some restrictions on the amount of sound, loud sound which they play. And of course, with the upcoming Diwali festival, the government should also consider putting some kind of restrictions on firecrackers which make a lot of sound.
Okay, that's really insightful from your end, doctor. Next question will be a little relatively medical question from my end, which will my question to you is that what are some of the most rewarding aspects of being an ENT specialist in your past 14 years of career as an ENT surgeon?
See, as you know, God has blessed us with 5 special senses: the vision, touch, smell, taste and hearing. As an ENT surgeon, I'm privileged that 3 of those special senses come in my domain. So, if by the skills which I have acquired with God's grace and with my hard work, if with those skills I can help some person to restore to at least some extent one of the special senses which he has lost, it really makes me. Also, I see a lot of children who put some kind of peanuts or some toys or some toy batteries in their nose or in their ears, and the parents are in a really bad shape. More than the children, it is the parents who panic. And when we take out these things from the nose or the ears of the child, the relief which is seen on the parent's face is much more than any financial gain. So this is a really rewarding my career.
I really understand what is meant by what you wanted to share to us. It's great to know about all these things. Now again, I would like to understand that as an ENT surgeon, this field of ENT, how has this field evolved over the years, and what are the latest advancements where people would like to know that what it was 20 years back is become more easier in ENT in today's date. Can you give a little bit of insights on that as well to us?
So when I joined my MS ENT course way back in 2003, that's almost 22 years back, the simple OPD examination used to involve a bull clamp and a concave head mirror, which is in itself a very cumbersome assembly. Nowadays, the setup has completely changed. No one uses a bull clamp, no one uses a concave head mirror. We all use LED headlights. Also, to look deeper into the crevices of the nose, to look deeper into the ear, we have advanced endoscopes, we have HD cameras, which offer a really in-depth.
This question should be related to the patient. Like, what is the advancements in ENT in terms of surgery or management of ENT, where a non-surgical thing has also come up, or a keyhole surgery has come up, where patient is more relaxed to go to an ENT. So we'll take this topic on that
Okay.
part more. So I will re-question to you. So Dr. Ninad, now you have more than 14 years of practice purely into ENT. I would like to know that how ENT has become advanced, what it was 15 or 20 years back. Like, for a patient who wants to reach to an ENT surgeon, what has the recent advancements made him more comfortable into something known as a keyhole surgery or a non-surgical way of looking into any ENT ailments? Can you give more insights on that to us, please?
So nowadays, many procedures which were done, say 20 years ago, as a inpatient procedure. So many of the ENT procedures which were done, say 20 years back, as a inpatient procedure. Now, with advancement in recent new surgical techniques, many of the procedures can be done on an OPD basis. For example, I give you one example. Some people come with hoarse voice, and the reason which is found is paralysis of the vocal cord in the voice box. Now, the surgical treatment involves injection of some material like Teflon or something into the vocal cord. 20 years back, this used to be a major surgery, like taking the patient under general anesthesia, admitting the patient to the hospital, taking him to the OT, and doing all those things. Now, recently, with the availability of good flexible endoscopes, this procedure can be done as a OPD procedure, and the patient can go home within an hour. That is one thing. Secondly, with the advancement of lasers in ENT, surgeries like stepy surgery for restoring the hearing can be done with minimal complications or minimum risk to the patient. Thirdly, with the advancement of endoscopes in nose surgery, nowadays major neurosurgical procedures like tumors of the pituitary gland can be approached to the nose, and a major incision over the head with shaving of that and all those things can be avoided, and the patient comes out of the OT with a simple small dressing over the nose, and no one may even realize that such a big surgery has been done. So these are all those things which have developed over a period of time.
These are really certain great advancements which not only save the time, the life-threatening factors which come across for general anesthesia and complications of major surgery, that sometimes can be avoiding complications of the surgery as well. So these advancements are really very nice to know from your end, doctor. Now, a few tips I need from your end for upcoming budding medical people who are in medical field, especially the students or people who want to opt for ENT as a specialization. How is the growth in ENT in next 10-20 years? As the future of ENT, you can see not only in India but outside India as well. And I would also like to know any super specialization or anything in advancement ENT surgeon can think about for his medical practice to get a niche touch for his own betterment. Can anything inputs you like to share it to us?
Okay, so anyone who gets a degree of MS in Master of Surgery in ENT are eligible for super specialization, that is MCH degree in 3 branches, which is recognized by the MCA, Medical Council of India. So those are neurosurgery, plastic surgery, and head neck cancer surgery. These are the official degrees which can be, for which an ENT surgeon is eligible, provided he clears his super specialization entrance exam. Okay. Apart from this, there are a lot of informal branches developing in ENT itself. The major one is in laryngology. So laryngology in itself is developing as a subspecialty, and there are many people in our city who practice exclusively as laryngologists. Apart from that, you have people who do skull base, people who do exclusive ear work. So in that sense, ENT is now much more multifaceted than what it used to be. In ENT, we jokingly say ENT stands for all in no time. So the misconception that ENT people are not doing well is not correct. So for any budding, not budding, I will say any person who has cleared his MBBS and is looking for a post-graduation, I will definitely say that ENT is the field which should be looked up to, and the future is very exciting in ENT.
Oh, that was really thoughtful from your end to share all these inputs. Not many doctors are comfortable to share on all these ideas, and I'm sure many doctors who are watching this channel will definitely think over having ENT as the specialization and will give importance to this stream. So thank you so much, Dr. Ninad. Once again, Dr. Ninad has his own clinic, Dr. Ninad Narkar's ENT clinic, which is in Dahisar. The details of which will be flashed to you on this channel once while we are having this chat. And people who are looking out for any kind of help in ENT, do visit Dr. Ninad. He is a leading practitioner in that particular area, but people far away from Vasai and Virar also attend his clinic. So he is that popular, and I'm sure he will give you the right suggestions. And thank you so much once again, Dr. Ninad, for coming to our channel and giving your esteemed interview with us. And all the best to you. Thank you so much.
Thank you very much, Vishal.